really, really sorry, but unfortunately not terribly surprised to have to stand here and have this press conference. Because for more than 50 years, women across this country have had the right to access the full health care they need, including abortion, in this country after Roe versus Wade was decided in the court's landmark decision. And just like that, millions of Americans may lose that right to have the health care that they need. Just like that. If the Supreme Court does what it's now expected to do, if it overturns Roe versus Wade, half of the states will either completely ban abortion in this country or severely limit it so that many, many people will not be able to get their health care. And you know something? For people in many of those states, just like that, abortion will become a thing of the past. You know, bans and restrictions on care apply equally to people in a particular state. But bans like this one, they disproportionately impact poor women and women of color. Because if a state next to Colorado bans abortion, but Colorado, which it will, keeps its fair and just abortion laws on the books, then wealthy women and white women, they can get on a plane or they can get in a car and they can go get the health care they need. But poor women and women of color will be stuck. They will be stuck. And that is wrong and that is unjust. People can't afford to take time off of work. Most women who have abortions already have children. Those people can't afford to get child care to get the health care that they need. And study after study shows that when women are denied the right to an abortion, it impacts their physical and their mental health for the rest of their lives. Studies also show that women who are denied abortion services are 3 times more likely to fall into poverty. That's what this draft opinion by Justice Alito is saying to the women of America. Poor women, women of color, too bad for you. You're going to be poor, you're going to be saddled with burdens, and you're going to have mental and physical health issues the rest of your lives. So make no mistake about it. While Colorado has taken steps to protect women's rights to abortion care, we are not immune to this decision. This decision impacts women all across America. And the groups here today will tell you this decision will have a real impact on women's ability to get the care they need. Now, I've got to say, as co-chair of the pro-choice caucus in the U.S. House, I am so proud of the work we've done because for the first time in history, we have a pro-choice majority in the U.S. House of Representatives. And me and my co-chair, Barbara Lee of California, worked with Speaker Pelosi after that first decision on the Mississippi case. And we passed a bill in the House, the first pro-choice legislation to ever pass in the U.S. House of Representatives, to codify Roe versus Wade, and to say, as a nation, we believe every woman should be able to have the health care that she needs. But then the bill went to the Senate, and the bill did not pass the Senate. And so I'm here to say the Senate must act to protect the health care for every woman in this country, not just women in blue states, but women in every state, because we are all Americans, and we all deserve a right to full health care, and that includes abortion. Now, I'm going to tell you, if the Senate won't act, people are desperate, and they say to me, what do we do? Who will act? And I will tell you, the voters must act. And the voters must act today, in every primary, and they must act in the fall to make sure that we keep our pro-choice majority in the U.S. House and that we take enough seats in the U.S. Senate so that we can pass laws making sure every woman has the right to full health care, including abortions. That needs to be the goal. And every single American who believes in this needs to figure out a way today, tomorrow, next week, and next fall to make this happen. Because I know that our willingness to fight for justice and to fight for women's health care is why people like me ran for office in the first place. And we're going to continue this fight until we get the justice that we need. We've come too far to roll back this clock. We're not going to roll back this clock. We're going to make sure every American has their voice heard on this. And with that, I have some wonderful advocates with me today who are going to talk about what this means for Colorado and what we need to do. So first, I'm going to turn it over to Adrian Monzanaris with Planned Parenthood of the Rocky Mountains. Adrian.
Thank you so much. Thank you. Good morning. Thank you so much for being here. I am here to reassure everyone who's listening, reading, viewing, and checking in that our doors are open at Planned Parenthood of the Rocky Mountains. Just today, we are seeing patients across our region, not only here in Colorado, but in New Mexico and southern Nevada as well. Those are states where we have seen patients travel from across the country to receive this critical care. And yes, indeed, we're seeing more and more patients across the country just yesterday make more appointments. Our patients come in terrorized, they come in stigmatized, they're fearful that someone has a bounty on their head because they are accessing the best care that they can get. And as Congresswoman DeGette mentioned, half of our patients seeking abortion care are already parents. They're figuring out childcare, but more importantly, they're figuring out the future of the next generation of their children. They've made an important private decision with a healthcare provider that no politician should ever have access to. And indeed now we see that our justices, the Supreme Court itself, has decided that they'd like to have an opinion on the health care of our patients. It's unacceptable. And again, I will say, our doors are open. It is incredibly important that patients know that they know that this is very common health care, that they know that they are making the best, most private choice for them and for their families, and that they will have a compassionate, welcoming, warm experience at Planned Parenthood and all of our partners and providers across our region. Thank you so much again for having this conversation and for keeping in mind the patient. Think about the women and people accessing abortion care wearing shoes you will never wear. I never know all of the reasons why folks are seeking abortion care because it's not my business. I just want to make sure that they get the health care that they deserve. And I'm so excited to introduce my colleague and friend, Karen Middleton, the Executive Director of Cobalt.
Thank you.
You bet.
Thank you, Adrian. Thank you, Congresswoman DeGette. You know, Cobalt Advocates also stands alongside Planned Parenthood and all the members of our Reproductive Health Rights and Justice Coalition to say, one, we need to call on the U.S. Senate to act, to take up the vote that will assure that we can protect abortion access when the courts clearly are signaling they will not. I also believe that our Colorado care is second to none. We are ready. We have clinics across the state, including Planned Parenthood and independent providers. We have an abortion fund here in Colorado. We have practical support, plane tickets, childcare. Whatever you need, we will make sure that we can meet you where you are and help you get either to Colorado or to a nearby state so that you can get the care you need. And I want to, if you'll welcome Danny Newsom, our Strategic Engagement Director, who can just talk a little bit about what we're doing to make sure that we're talking to everyone across Colorado so they know that abortion is accessible and available here in our state.
Good morning. Thank you for being here. My name is Danny Newsom, and I just want to go off of what Karen and what Adrian said. Abortion in Colorado is legal. Frankly, it is still legal, although we have so many states that are taking steps to ban or severely restrict abortion. Right now, it's legal, and we are ready. Cobalt, Calor, Planned Parenthood, and the rest of the members in our coalition spearheaded the passage of the Reproductive Health Equity Act. in Colorado that Governor Polis just signed last month. That was an incredible act. For the first time in Colorado since 1967, there's legislation that protects the right to abortion. But a right without access is not helpful to the people that Representative DeGette talked about, to so many people who are lower income, and that disproportionately falls on people of color. And so the access is an issue, but we are working on access. As Karen said, Cobalt has an abortion fund. There is no income requirement, there's no income threshold. It is open. And so if you need abortion care, we're here. You can go to cobaltadvocates.org and you can follow through and get the care you need with assistance from Cobalt. If you have an appointment, please, please, please keep that appointment. Because we're not turning our backs. The courts have. It's tragic, it's horrible. I was born in 1973, the year Roe versus Wade, I graduated from high school, telling a lie there. Graduated from high school the year Roe versus Wade went into effect. And I literally, as an adult, grew up with Roe versus Wade. And so as tragic as it is, right now I have a daughter who's 28, and I'm thinking, oh my goodness, I grew up in a country where I had more rights regarding my reproductive health than my daughter may nationwide. But please remember, in Colorado, we are protected. Please, please, if you need help, seek help. We are here to help you. Thank you very much.
Thank you. Questions?
How are staffing levels doing preparing for an influx of people?
Adrian.
Sure. Yeah, it's a great question. So we are always hiring at Planned Parenthood, the Rocky Mountains, a variety of different staffing positions. Fortunately, we have licensed providers who've stepped up to provide care. Right now, we're looking more for employees that have the operations, so how to run a health center. We're also always hiring in support departments like our HR department, our administrative departments, our financial departments. As we're increasing care and hiring more providers and seeing more patients, we have a wonderful support network of staff that also has to be filled up and trained and brought along as well. Great question, thank you.
I will say, though, on a national, and I think Adrian will agree with me, on a national level, if abortion becomes illegal or practically illegal in half of the states, Planned Parenthood and other abortion providers will be overwhelmed with people from out of state who are trying to come. So the current staffing issues will be really, really exacerbated a lot. And of course, that doesn't even account for the people who can't get to another state. Yes?
We've seen and heard Senators Lisa Murkowski, also Susan Collins, just talk about their distrust with the court now after this decision week. Are you confident that you could sort of get them on your side with this measure in the Senate to sort of vote on this? We've seen things stall over and over in the Senate, so how do you sort of force it?
Well, I will say that it's hard for me to believe that 2 U.S. senators could be so naive as those 2 senators during the confirmation process to believe that Justice Kavanaugh and Justice call me Barrett, but also Justice Gorsuch would uphold Roe versus Wade. I'm shocked to hear that. I was also really dismayed because when we passed our bill in the House, the Women's Health Protection Act, which codified Roe versus Wade, put it into the statute, both Senator Collins and Senator Murkowski at that time said they would not support that bill, even though it did put Roe into statute. So I'm with I hope that those 2 senators, Collins and Murkowski, now realize that we're playing for real now, that really what's going to happen with this Supreme Court decision is millions of women are going to lose their right to an abortion, and maybe they'll come to their senses. In a way, the horse is a little bit out of the barn, but maybe they will come to their senses and help us fight to pass this in the Senate. I mean, the good news is, as I said, for the first time, we were able to pass it in the House. We have a pro-choice majority in the House. We have to keep that in the November elections, but then those senators have to help us get the votes to pass it in the Senate, whether we eliminate the filibuster for this purpose or whether we get 60 senators who will vote for health. That's what they have to do.
Are there any other plans in place, just seeing how things have sort of played out in the past couple
I think, well, of course, the leaking of a initial draft of a Supreme Court decision is unprecedented and unheard of, and so most people were expecting the decision to come out in June at the end of the term, and so we've had a number of plans, and there are a number of plans, but they're being expedited right now. I'll probably be talking to Speaker Pelosi today, and I'll be also seeing some campaign folks later today.
Don't talk about votes, but a lot of states are putting voter suppression out there, not allowing people to vote. So how do you manage that when you're trying to say get people out to vote, but some states are limiting the way you can vote?
Well, so voter suppression is the goal of the right wing, and they have passed a number of laws to suppress the vote, but we have to do two things. Number one, we have to continue to pressure the Senate to pass voting rights legislation, the John Lewis Voting Rights Act and H.R. 1, but also people in those states can't just give up. They have to go out and vote. We've seen this before. We saw it in Georgia in the elections in 2020, and people can't give up. They just have to go out and make their voices heard.
Adrian, could you quantify what kind of increase of out-of-state patients you've been seeing and how that might change, what that might look like in a post-Roe world?
We've always had patients that come to Colorado for care. That's a common thing from across the country. But what we've seen is a dramatic increase since Texas passed a complete near ban of abortion care in September. Those numbers have gone up by the thousands. I mean, it's really remarkable across the region. So both in Colorado and in New Mexico, and as Congresswoman DeGette mentioned, for women who have the means or are able to access abortion care funds, they will hop on a plane and go to Las Vegas for abortion care. So it really just demonstrates the number of times in which if a person does not want to be pregnant, they will do whatever it takes. And for us, we really do. We want to welcome them to come out of state, make sure that they have the access to care that they need and to funds that they have so that they can do that.
You know, Adrian makes a good point. And I'm about the same age as you, Danny.
You're high school.
The
You
real
born in
age.
1973?
The real age, right. And before Danny and I were in high school, it's not like nobody had an abortion. People had abortions. They had abortions at great risk to themselves. Many people died. And so what'll happen if these states are allowed to ban abortion, people will die. And that's just unacceptable. And I know so many wonderful groups like Cobalt, like Planned Parenthood, so many more are working to help women in those states. But the bottom line is, why should someone have to go to a different state in order to exercise her right to fundamental health care services? It's not American. Anyone else? All right, thank you all so much for coming.
Thank you.
This
so
won't
much.
be the last of this.
Thank you.